Now let's review some techniques for the lumbar spine. We'll start by applying our emollient. So in Module 1, we started with GT1 doing sweeps and fans. Remember not to rake over the spinous processes. Be careful of the PSIS. Be careful about the ribs. And I would typically treat his left side on the left side of the table. And then we progressed to GT4, doing sweeps and fans. All right. We could add in some instrument-assisted skin rolling and C-bowing. All right. And then our C-bowing. And he's a little restricted here in his superficial fascia and his lumbar spine. All right, now let's start adding in some dynamic techniques. We could treat the super and interspinous ligaments with the tip of GT6. So in Module 1, we just did this statically. We could do this dynamically by having our patient do a press-up. So hands under your shoulders, use your hands to push your shoulders up as high as you can. And back down. Good. Keep going. And we can make this more of a dynamic treatment. Good. Keep going. Likewise, I could come into the erector spinae, thoracolumbar fascia. I could do sweeps, fans, fascial spirals. All right. But in prone, he can only come into extension. If we want him to come into some flexion, a quadruped position might be more appropriate. So let's have you come up on your hands and knees. All right. Bring your hips. There we go. And then you're going to arch up and flex your head, and then sag down and extend your neck. Good. Back and forth. All right. So now with a dynamic movement, again, we can go back to our sweeps. Good. Fans. Good. Fascial spirals. Good. If he were lacking flexion mobility, we could do pin and stretch, pin and glide. So this would be a shortened position. You're going to sit back on your heels, keep your hands in place, drop your shoulders down, and this would be a lengthened position. Come back up. So we're going to start in a shortened position. I'm going to take GT4 and pin, and going back, sit back on your heels. And then you see the stretch. Good. Come back up. Pin and stretch. Good. And then with a pin and glide, go ahead. The instrument's going to flip and move. Good. Pin and glide. Keep going. Remember, pin and glide, we can go multiple directions. So as he comes up, I can come this way. Start here, pin and glide. Pin and glide. Good. All right. Now let's have you sideline facing me. Scoot towards me. Bring your knees up. So this is a technique to improve lumbar rotation mobility. So I'm going to have the patient flex his knees up as high as he can. I'm going to try to sit right in front of his shins here. All right. And then you're going to take your hand and rotate. Good. And back up. All right. So this is going to be a shortened position. When he rotates, that's a lengthened position. Okay. Hold that position. I'm going to take GT1. This is going to be a little different. Remember, with a pin and stretch, you want the bevel of the instrument against the tissue. I'm going to use my left elbow to lock his sacrum, come above the PSIS, between the PSIS and the ribs. So I'm going to pin his lumbar spine, and now go ahead and rotate. And that's the stretch. Good. Pin and stretch. Good. Pin and stretch. Now, in the situation, if you do have a patient that's larger than you and you cannot reach here, you could do this and sit in front of the thighs. But here, it's more difficult to lock the lumbar spine here. Pin and stretch. So that would be a modification for those smaller therapists working on larger patients that just don't have the size to be able to reach over the patient in the first position. Now let's have you in a seated position facing me. So other techniques we can use to improve lumbar flexion, we can progress to a seated position. So from here, take your hands between your knees and drop down, and then just move into some flexion, and then back up. Good. So we could treat the lumbar spine here. Remember, if he were lacking motor control, I might be doing faster movements, right? I might be doing some fascial spirals. Keep moving. Good. If he were lacking mobility, I might do pin and stretch, pin and glide. So pin, go ahead and flex. And you can see the stretch, come back up. Pin and stretch. Good. I'd be doing this on both sides. Good. Pin and stretch. And then a pin and glide, we would flip the instrument. Good. Pin and glide. You could see some welting where I treated his supra and interspinous ligaments. That's a very common response. All right. We could also progress to a standing position. All right. This would be very advanced, but we can progress to a standing position. And again, you would just bend over and try and touch your toes. Good, and back up. And then I can treat, go ahead. Good. Again, if you were lacking motor control, I might be doing faster strokes, try to facilitate the motor control pattern. Fast sweeps, fast fans, or fascial spirals. Good. If you were lacking mobility, I might do slower strokes or a pin and stretch. This is shortened, pin it, and then he's elongating as he flexes, pin and stretch, or a pin and glide where we flip the instrument. Terrific. All right. Now we can reassess how he's moving. So let's have you stand facing away from me, feet together. All right. Let's have you bend over and try and touch your toes. Good. And he's getting much better excursion there. Good. Hands to the ceiling. And let's have you back bend backwards. He's still not getting a good uniform curve there. All right. Let's face the windows. Arms at your side, feet together. Feet together. And let's have you rotate to the right, hips and shoulders. Again, we're looking for 50 degrees through the hips, 50 through the shoulders, and rotate left.